Hello, this is a presentation about my ankle evaluation and how I can improve on it. So first off, let's start with an introduction. I am Megan Bibler. I am a newly certified athletic trainer that just graduated from Ball State University, and now I am a member of the Indiana State Doctorate in Athletic Training program. So what my evaluation consists of right now is we're talking about not sideline evaluations, but more a patient comes into me in my athletic training room and how this goes. So I just listed off my steps I usually take. I start off with introducing myself because I've only been at this high school for 2 months, so not all the athletes know me. And then I take the athlete through a series of history questions and try to figure out how the injury happened and how more about the injury itself. And then I go to palpation, so I feel around, see if I feel anything weird, and then move on to manual muscle tests, special tests, and then a diagnosis. So I'm going to go through step by step and talk to you about why it's important for each step. So for the introduction, I think this is one of the just a good step that sometimes people forget to do because they know they're the athletic trainer, but not everyone knows exactly what that is and how we work. So I let my patient know who I am. I want to get them comfortable talking to me so they can open up to me about the concerns that they're having and all that. And then I always want to figure out, what activities they do. So if they play a sport, what position are they, and how can this relate to their injury? After the introduction, then I move straight to the patient history. The most important things of this is really diving down deep into the question. So, when did the injury occur? How did it happen? Has the patient ever injured that area before? Um, I feel pretty strongly about my history. I was taught in undergrad that this is one of the most important parts of the evaluation. You can really find a lot of good information here. Does it hurt in the morning? Does it hurt at night? Does it hurt when you're playing, or does it feel better when you're playing and hurts more when you're done? So, I really like the patient history. I feel confident with that. The one thing that I think I skip out on is really checking if the patient has had any injury before, and really skipping over sometimes they're more of their concerns and not really just I just ask them questions. I don't really let them tell me, what they came in here for and what they're the most concerned about. So then after that, and then I start with my palpations. I figure out what area is most tender. I try to figure out, okay, is that directly on a bone? Is that on a ligament? Is that on a muscle? And then I check for any deformation. So really dig deep in there. They don't like it when I do that, and they mostly always say it's painful, but I really try to see, okay, do I feel any hard crust or any step offs? If I push down, is that swelling going to stay? And then check for capillary refill. Then I move pretty much right on to manual muscle tests. So if they're complaining of quad pain, I really want to differentiate if what quad muscle it can be or if it's an abductor, adductor. So that's why I really like to focus on manual muscle tests. And just to see, and I always like to compare both legs. I think sometimes when I'm in a rush, I forget to do that, but if I'm really focusing on giving my best evaluation, it would be focusing on really compare bilaterally in all these steps, and that's one of the ways I want to improve on my evaluation. The second, or not second, but the next thing I do is special tests. So I narrow in on that diagnosis. I really like special tests. And I would say by this point in time in my evaluation, I usually am pretty certain what I think this is. So sometimes I get tunnel vision and only do very specific special tests, and I miss out on, just checking for everything that I can. And then I do a diagnosis. I give my patient my opinion on what the injury is. And then right after I do that, I go straight into telling them what I think we should do to make this better. I don't really sometimes I forget that, okay, a patient might not know what a meniscus is, or a patient might not know what a labrum is. So I really need to stop a second and really explain what this injury actually is and what it means to them. So gaps in my evaluation. This took me a long time to, not a long time, but I really focused in on what I think I can do better at because, and it was tough for me because I'm a big advocate on whole body, whole person care. So, but when I look back and think about my evaluations that I do on the field and also in the athletic training room, it's busy in there. I'm trying to get everyone going. So I think I missed out on some of the patient concerns. So that is one of my gaps in the evaluation that I really want to focus on. Another thing when I was thinking about this is I sometimes skip over range of motion. I go straight to the manual muscle test, but that doesn't always show me, can they reach their hands all the way up 180 degrees, or can they fully flex their knee backwards? Yeah, I can test their muscle strength, but is there any blocks in that? So I really want to focus in on that range of motion, and really range of motion wise more of their function. So like I have a volleyball player come in, she has a sore shoulder. Yeah, I test all of her rotator cuff muscles, but did I test if she can fully move her shoulder all the way back for a serving position? So that's another gap I see in my evaluation. Differential diagnosis. Sometimes I don't think giving patients too many ideas can confuse them, but for me, myself, and I need to stop getting tunnel vision and really think, okay, what else can this be if it's not an ATF sprain? Can this be a bone bruise? So I really need to focus in on, okay, what other things can this be? And then to really secure and move my evaluation process forward, I really need to start getting in the habit of administrating an outcome measure. So having those on hand, giving those to patients, because sometimes like my concerns are for the patient, my patient's concerns, that can be covered by outcome measures if I administrate them. So I really want to focus in on that. And if I'm busy, have my patients sit down, fill the outcome measure out. They're not too busy to not be able to fill out a 5-minute questionnaire. So how I'm going to improve. Like I mentioned earlier, I'm really going to focus on that whole patient care. Like, what are their concerns with this injury and how can I make those better? I really also want to observe the patient's physical ability. Someone walks in and says their ankle hurts. You know what? I get busy. I have them sit down. I look at it, tell them what I think it is. Did I really watch them run, jog, sprint, cut? I don't think I really do that. So I need to focus on that. And I want to really be aware of my tunnel vision and make sure that I am looking at all aspects of an injury. And then, like I just said, have outcome measure forms in an open area where I can see them and I can be remembered to say, okay, here, sit down, do this while I'm over here taping this other athlete. So, my evaluations are decent right now, but I think there's always, anytime you can always continuously improve yourself. So I'm really taking this assignment seriously and excited to see and do all these implementations that I've just thought of.